Fat transfer today. This was harvested from this patient's thighs. I take it from different places depending on where it's coming from. Then once I get that fat out, I turn it into different types of fat depending on what the purpose is I'm trying to do. So for example, here's the 3 types of fat we are using today. This is what we call millifat. This is structural fat, and those fat cells are about 1,500 microns or 1.5 millimeters. This is what we call microfat. This is about 1,000 microns or 1 millimeter in size. When we get done, you can see that's a little bit more fine. This is going to be for key areas that is a little bit more detail oriented. This could be around the eyes, around the mouth, a little bit less structural, a little bit more rejuvenative. And then we get to the ultimate when we talk about rejuvenation for fat transfer. This is what we call nanofat. This is about 0.5 millimeter or 500 microns. This is essentially at this point just rejuvenative stem cells and growth factors coming out of the fat. There's very little to no structural benefit to that. That is all for the rejuvenative effects of the fat. And so for our patient today, we're in a revision situation. So I'm doing some restructuring, I'm doing some detail work, and I'm treating some prior scar treatment and qualitative issues that she had after her prior surgery, which is where the nanofat is coming in. So with one harvest site for her from her thighs, sometimes it's the abdomen or the flanks, I'm able to get a lot of different tools out of that one single fat transfer.